Hey everyone. Today I have with me Brandon Ansara-Milbaugh. He's a personal trainer, and he's going to be talking a little bit today about the relationship between mental wellness and exercise. Thanks for joining me. Can you tell me a little bit about your background?
Yes, so I have been doing personal training for about 12 years now. And I would say about 8 years of that has been focused on longevity training. So usually that's more of a 50 plus category in age, but really it should be for everybody, just trying to set yourself up long term for health. And I think it's very aligned with what you do as well.
How would you describe the relationship between exercise and mental health?
I think there's a lot of overlap between the mental aspects of health and physical exercise. I think if you're physically active, generally that's a nice outlet for you. And mentally, I think there's a lot of benefits that come along with that. And then on the reverse side of that, I think if you're taking care of your mental health, I think that really shows up in your workouts and your performance. So I think there's a lot of overlap between the two, and they definitely have a lot of interplay where they help each other out.
Do you have any stories that you could share about how exercise has made a significant positive impact on you or any of your clients in their mental well-being?
Oh yeah, I have a lot of great examples of that. I think for me personally, I tend to be the type of person that accumulates stress and does not have a good way of dealing with it unless I have some kind of a physical outlet. And I've noticed this a lot of times if I go away on some kind of a trip for multiple days, I can tell that my anxiety is higher, my stress levels are higher. So for me personally, this has always been a fantastic physical outlet, and I feel like our bodies have kind of evolved to need something like that, um, to go along with the other things that we would do to take care of our mental health. And then, as far as for some of the members that we've had here, a ton of examples. I just had someone that recently moved here that was diagnosed as being bipolar. And candidly, I really did not even know if I needed to adjust any of the workout routines we had for somebody just to cater to them a little bit better, and or what to say or how to approach that type of person. And it's interesting to me because I have not done anything differently, and I feel like that individual has significantly benefited in the last couple months of just getting into a routine. And I without no intervention on my part, they seem to be much better spirits, much more consistent, much more level headed. And just amazing to me that exercise as part of a holistic grouping of things seems to make such a difference on an individual's life like that.
So, what do you do to take care of your own mental wellness?
I would say, and I wouldn't say that I do it exceedingly well, but I am getting into meditation. I've been doing that for a little over a year now. And I would say it's probably one of the best changes I've ever made in my life. And it's something where I can see the benefits in all of it. My sleep is better. My nutritional habits are more consistent. I feel like my focus is, I would even say it's got to at least be over 100% better. And it's not even something that I'm doing for a long amount of time. I've worked my way up to 15 minutes of just a kind of a focusing type meditation, just working on focusing on breathing or some type of image. And then I generally follow that up with about 30 minutes of a more of an analytical type meditation, just me working through some problems or concerns that I have. And I have seen huge dividends for myself. I know it's one of those things everybody always says they have great progress with, and then it's just hard to get going. And it seems like every month I get better at it. And I'm very excited about what it might do for the rest of my life.
That's really great. I think mindfulness is one of those underutilized tools that have really significant impact on people's mental wellness, regardless of, whether or not they have any kind of diagnoses or anything.
Very much so.
So, what advice would you offer for those exploring utilizing exercise as a means of improving their mental well-being?
A few different things. The first thing that comes to mind is maybe just trying to get started as soon as possible. I think sometimes there's this big barrier to entry, and then I'm the person that gets to be on that other side of that barrier to see how well people do. And it's just kind of hard to get past that point to get started. It does not have to be perfect. Just get yourself in motion, get some kind of a plan, and get going with it. The second thing I would follow it up with is, especially as it pertains to mental health and specifically for myself, as a really good example, it doesn't have to be really big leaps and bounds improvements, just any improvement. So I would track what you're doing, whether that's running or weight training, whatever the exercise is, I would track it so that in the short term, even if you haven't lost that 30 pounds that you're looking to lose, you can show yourself that you're making progress. And you have to be able to get excited about those little changes. If I'm moving up slowly on my squat, yes, my legs don't look like a bodybuilder yet, but I know that I'm headed in the right direction. And if I've only lost a pound, I know I'm heading in the direction of 30 pounds. So make sure that you're tracking everything that you can show short-term progress. If your only goal is to lose 30 pounds and that's the only thing you care about, and you're not going to be happy until that exact thing happens, you're kind of setting yourself up for failure because there's nobody on the planet that's going to go that long without seeing some kind of reward. So I think having some small goals that you're tracking well and then meeting those goals and being excited about it is a really big deal. That would be my recommendation for getting started. I really truly think that this is just such a wonderful thing to take care of yourself, and I think it pays dividends in the long term. And it seems to me like I've always believed that personally, but every year I believe that more and more and find more evidence that that is the case. I've always thought that the four pillars that kind of hold our health up are going to be your nutrition, your sleep, your exercise, and your mental health. And it just amazes me how when doing one really well really affects the other three. If I'm taking care of myself mentally, it's so much easier to follow a diet. It's so much easier to get better sleep. So much easier to come in and exercise and be focused and committed. And I just think it's nice when you can even just start trying to help yourself from those four things, even if it's not perfect. If one category is completely untouched, there's all that low hanging fruit there. If I haven't done anything into investing into my mental health, I can probably do a little bit of it and it's going to go a long way. As opposed to if, say, for example, all you want to do is exercise and you don't want to worry about your mental health, your nutrition, or your sleeping. There's only so much progress that you can get out of exercise if you do it every single day. If you're not doing any of the other three, then just a little bit of effort in those areas, I think, makes such a huge difference so quickly. So I guess that would be my only thought as a closing idea.
Well, thank you. I know you're really busy. Thanks for taking the time to talk with me today.